Kia ora tātou. Thank you all so much for joining us today as we walk through what's new in Medtech Evolution version 9.0. I'm Liz Agnew. I'm Medtech's product manager for New Zealand. And with me today, I have Rebecca Braddock, who is our head of marketing, and she's going to be assisting me with our Q&A session later on. Before we begin, just a little bit of housekeeping. So we are recording today's session, and we'll share that with everyone afterwards. And if you've got any questions as I go through the demonstration, please ask anything via the Q&A button at the top of the screen. If you click that, you should get a panel on the right-hand side, and there's a wee speech bubble. And if you click on that, you should see an Ask a Question button. So if you pop your question in there, and we'll pick those up at the end. Or if there's anything that Rebecca can address at the time, she'll flick those through. So our walkthrough, it should take about 45 minutes. And I will be referring to the release notes, which are available on our customer portal Insight. So please make sure that you locate a copy of those. Just a note on those release notes, we have updated them. We've given them a bit of a glow up so that they should be easier for you to navigate through. We've got some color coding so you know what type of change you've got, whether it's a new enhancement or a change. And if it is something new, you've got a bit of setup effort. So it may be that some role-based access control is required, but we provide a step-by-step guide through those changes. Also adding in some screenshots, pictures are always good, and then you can ensure that you're looking at the right area. And then at the very end, we've added in some troubleshooting. For the release notes for version 9, as mentioned, good to get into hold of them. I'll show you a copy here. We have at the very end got some appendices. The Appendix A has got the vaccine codes from EAR. We've got the indication codes, and then we've got what the evolution codes are that are related to those. So I would recommend getting a copy of those. Okay. All right, so at a glance, version 9, it is a sector release. It is mandatory because of those sector changes, and we released it in June. It's got 23 features and changes, and they cover 3 integration areas of EAR, the Aotearoa Immunization Register, Shredder, Shared Digital Health Record, and GP to GP. We'll be mainly concentrating on the EAR changes and a little bit of a mention of the GP to GP at the end. Just a note about claiming. So Health NZ updated their electronic claiming codes and have ended the manual back payment for co-administration fees from the 1st of July. So to claim your immunisations correctly, that co-admin fee, you need to be running version 9. So we had our release till the 24th of June at Health NZ's request, so that would align with their pro-claim changes. So until you're upgraded, preview, check and finalise your immunisation claims as normal, but do not send them through. Pro-claim has advised these will be rejected. Your single vaccine claims and your flu and your flu zoster co-admin claims aren't affected, so you could send those as normal. Once you've upgraded, you can send those claims. You do not need to unfinalise. Just go into your HL7 electronic claims area and send them through. The correct payment will be sent through from ProClaim, even if the subsidy that goes through is 0. And you will see an adjustment in your ProClaim reconciliation correspondence. To deal with that, we recommend creating an overpayment invoice to adjust for that additional co-admin payment in your immunisation funder account. So today, as I mentioned, we're going to be concentrating on EAR. There are a lot of different areas that have been adjusted following the specifications provided by Health NZ. and a couple of GP to GP changes as well. Okay. All right, so I'll move into evolution now. So we've updated any place in evolution where it said NIR, National Immunisation Register, to the new name of Aotearoa Immunisation Register. So you'll see that under areas like reports, where you've got your ear immunisation audit. You'll see it under utilities, where you've got your ear message transfer area. Under patient in your immunisations area, you've got your ear status query, either through the drop down on your patient ribbon, or if you're on your IM screen, you've got your ear status here. You will also see it in your provider inbox with your ear folder. NIR will be changed to AIR. For all of the vaccines that are able to be used, Health NZ provided us a list which we've ensured that all those domestic vaccine antigens are available to use in Evolution. So as I showed you there on the release notes, but under your Evo button, options, recall screening and vaccine, you'll see the list here of all the vaccines that are in your system. Now, if you open up a vaccine, you'll notice that you now have a little tick here to say that it is an ear vaccine. These are ones that were already in the system that you might want to call factory data. They're the codes that Medtech have provided over the years in various upgrades. They have behind the scenes a CVX code and an indication, and where they don't, then we have flagged them as non-standard. You notice you've got these two new columns in the vaccine setup. So for non-standard items, if I scroll down, these are ones that practices that have added themselves. So if you see here, I've got a non-standard vaccine here. It's a flu 75. It may have been someone was doing some reporting or something and wanted something additional to gather. Not sure, but anyway, if I open that up, you can see here it's flagged as non-standard. It didn't have that CVX code or indication behind the scenes. If you want to keep using this code, you can. You have the two options. You can make this inactive if you would rather use the standard codes, or if you want to continue to use your code, you'll need to give it a put in some mapping. So we've got this new section down here, ear vaccine product mapping. You then choose what the ear vaccine is. So I'm going to put in flu, there's my influenza. And here I've got the indications that are available. So for this, I'm going to choose an over 65. And then I can OK that, and that will then allow me to use this code. If I don't do that and I'm in my immunisation area and I give a single vaccine and I put in that flu 75 and I know that it was given and all the additional fields. We'll get this message. So the vaccine isn't mapped, you need to go to setup and map that to continue. Okay. One other area in that setup is we have that column here that lists historic. So these are old ear vaccines that are no longer current. So we've flagged them as historic. You can still use them if you're putting in a patient's historic records. We've just hidden them away so it makes it easier for you're not getting a huge big list when you go to add a new term. So under the new immunisation term, you've got this tick box, include historic vaccines. Like that, this list here now has the current vaccines at the top. If I scroll down, there's a little line to flag where the historic ones come into play. Oh, there it is there. So these ones are historic. And you can type the description in the search box here to find them. We've also added a number of overseas vaccinations into Evolution. And if you go into a new term and go searching for them, say I wanted a polio, you can see I've got 4 here. And if I hover, you can tell which ones are my overseas ones. They're all marked, so I'll take this one here. And it defaults to being given overseas. For anything that's given overseas, you have now got the ability to add in more information if you have it to hand. So the route, site, batch number and expiry are now available to be filled out. But you can just hit OK and save that without them if you haven't got that information. Okay, moving on to having a look at how you deal with your co-administration fee and for those group entries of vaccinations given on the same day. So if you are doing your standard childhood immunisation schedule, excuse me, make sure your schedule selection has got the right schedule selected. You go to your immunisation schedule page as normal, and then either double click or click on highlight one and hit the new group button to add a group. The group will come up. Ensure you've got the right provider and vaccinator details, and then you can go through each line and entering the site and batch number and expiry. Notice you've got this new little warning here in red. When the batch number and expiry are entered, it records that and defaults it for that same vaccine until it is changed. So please make sure that that expiry date and batch number are the current ones. As you move down, you can highlight the next and put in where it was given and the details. And then if something else was also given on the day, you've now got these new add and delete buttons. So I can hit add, it gives me a new line here, and I can go in and say, okay, an MMR perhaps was also given at that time, and then you can add in the additional details here. So that means that these items here will all be claimed with the initial, and then all these 3 here will then claim the co-admin amount. Okay. Let me just pop something in here and I'll show you what that claim looks like. So if I OK that, and it says that I have got an expired batch expiry. So this now allows you to correct the information. So if I hit correct here, I can see that this MMR is out of date. I can then go to a future date and put that in and update it. Okay, so that's added in those items, and because I put in that 12-month MMR, it's also recorded that in that particular schedule. If I now look at the account screen for that patient under test baby, I've got this immunisation claim here, and it shows the first item and then the next 3 with their co-admin amount. So that is how it would look. Do not go and add them one by one by one. They will all go through at the top amount and get rejected. So it's important that you use them as a group. Another example would be if you had pregnancy vaccines. So if I go into the schedule selection and I choose that I want pregnant flu and pregnant Tdap, I can now see those there. I can double click to add a group, and I would want to hit add and then bring up that Tdap from here and add those two together. And if something else was given at the time, add a new line and find it. For your over 65s or 65-year-old flu and zoster combination, I grab a 65-year-old. Again, go to your schedule selection, make sure that you've got the right items selected, and they will all display here. I will then double click my flu 65. The way to do the co-admin for zoster hasn't changed. You go to the add remove here and choose the Shingrix co-admin. That will add that in. If you then want to add in the Tdap for 65-year-old, you could add and find that in here. Units. Right, and add those three in together that way. Okay. The co-admin for Shingrix is the same as it has been previously, and it's using that add remove. So we haven't changed that, just giving you the additional line to fill in there for anything additional. Okay, I'll go through and save that one just for. Now I'm putting in anything, you'll notice that I'm not with the accuracy here, I'm just filling out bits, but okay, when I save that, I'll correct that flu. So okay, when that's saved, notice that it's now put in my Shingrix in here with the co-admin, and then I've still got my second Shingrix there, and I've also got my 65-year-old Tdap. It's also been completed. Okay, if you are giving a number of vaccines that are not from a schedule, you can go to the All Immunisations tab, and there's now the new group button available. I say to that, you now have a blank screen where you've got two lines, so you can then go and choose the items for yourself from the list of current vaccines. Fill out the outcome, route site, batch number, expiry, diluent if appropriate, same as you would, but you're grouping them together. If you're giving them together, you need to put them in a group. Okay. Data accuracy has been a big focus of this upgrade. So AIR have updated their validation rules. NHI is mandatory. So you have a patient without an NHI number, and you go to add a new term or a new group. First thing that's going to come up is that they're missing the NHI number. It gives you the ability to correct this at the time, so you can go and then correct that, doing your NHI lookup to find the NHI number. Once you've put that in, Mm. And then it will look to see if you've got any other areas that need to be filled out. So it starts with your NHI first. And again, it will ask you to correct them and put the cursor where it needs the information to be added before you can continue. The next of kin rules have also been updated. So if we've got baby, and we go to give a vaccine, first thing we'll do is say that the next of kin details need correcting. So the preference is that that information is corrected. However, you have got the option to send that now and submit the record as is. If you do that, it is preferable that you go and fill out that information later, and you can resend one of the items. And a resend would be to open the particular item up, and you can edit it by putting something else in the note and saving that, and that will send the updated in next of kin data. Anyone who is under 16 will get the next of kin warning if the information is not recorded, and anyone over the age of 16, that message has now been removed. Another data accuracy issue has been previously there hasn't been any checking on the date given. So the date of birth for this baby, 25th of April 2025, I go back and try that and get a message saying immunisation date cannot be before a patient's date of birth. It can also not be after a patient's date of death. So if that's if you've got that recorded, you will also get a warning message. So more focus on having accuracy of data. When you are putting in your batch numbers, you will get warning messages if the batch numbers you saw earlier when I had the batch number is expired. Also, if that is blank, you also get a message popping up. It will, however, let you continue and send without that updated batch expiry date, but it is preferable if that information could be added at the time. So yeah, so following the prompts that are on the screen of what information is required is the preference in this circumstance. So you'll see that I've got no batch expiry here. Involved with patient is my non-next of kin. We can add that in quickly. And so here it's showing the batch number, the batch expiry is missing for those items. I do have the ability to send it now. Preference is that it's corrected. Okay. Previously, the outcome for various immunisations, for all the immunisations, had a declined due to natural immunity outcome. So we've now removed that from all vaccines except for 3. So the 3 that they're now available on are the MMR, measles, mumps, rubella, hepatitis A and hepatitis B vaccines. So if I was looking at, say, Min B, the outcome that declined natural immunity is not in there. This MMR, we have got declined by natural immunity. If I select that, natural immunity, these 2 new tick boxes are available. So evidence of immunity has been cited. So you need to have had, you need to record the evidence that has been cited, and then you can select yes for that. So I'd recommend scanning that into the system or recording it in your attachment manager, perhaps take a picture of it. So you can access that either through the group if you're doing the full group. Let's grab a new patient. So if I was doing that 15-month group, and I've got MMR here, and choose the natural immunity, decline due to that, then I have these 2 tick boxes here. So you can get to it via the immunisation group entry as well as the single immunisation entry. Okay, you'll be pleased to know that the reschedule reason has been removed. It's no longer required by EAR, so they've taken it out of that group screen. You would have had it up here attached to the recall. We've also removed it from the recall screen and the new immunisation term screen as well. So those inbox messages requesting reschedule reasons are a thing of the past. And a lot of the other information that has to be updated at the time, you will also find that you're getting less error messages in your inbox. Okay, so another change for when the claim is sent through to Proclaim, the provider's HPI number, if they have one recorded in the staff member setup, will get messaged to EAR. So in the staff setup, on the provider tab, you've got the HPI number here. So that will then go through instead of the registration number if it's available. We've also added in a number of different vaccinator assigning authorities. So in the affiliation here, you'll now see you've got a CIR vaccinator, vaccinating health worker, CPN, midwifery council, paramedic, pharmacy council. So and a healthcare assistant. So those there can be used and will get message through to EAR. Now, just an important note about affiliation. If you are changing the affiliation, you need to ensure that you update, if that particular affiliation is putting in notes, you need to ensure that the access to that notes is provided to the to other staff. So if you are adding in vaccinating health workers, you need to tick the affiliation daily record access for staff members who can access that particular affiliation's notes. So that's a very important setup step if you are going to start using these new affiliations. Okay. That is all of our immunisation updates. Just moving on to have a look at the new GP to GP features. So previously GP to GP exports were limited to a single file of up to 20 megabytes, and you had to save your larger patient records onto a disk or pen drive and send those manually. So the new GP to GP component from Health NZ allows you to automatically split a patient export into multiple files when that limit is reached. So Evolution calculates the size of the export before sending it, and if the file is within the max size, then we'll send it as a single file. But if it exceeds that max, we'll then go through the attachment manager and package up the attachments across multiple files, and it will give those files names ending in A01, A02, etc. So you'll have a primary file, which is your A01, and then you'll have some secondary files ending in O2, O3, etc. So if I grab a patient with some large files, and I go to my GP to GP export, who I'm sending it to, run through my screens to select what information I'm sending. I can see my attachments. I've got some very large sizes here on my attachments. So if I then choose to export that, it will run through and compile those into separate files if it reaches that limit. Okay, so under my tools and messages lodged, this is where you go to find your items that are being sent. From here, you can see that Arnie Smith has got two files. This is the primary one, and this is a secondary one. And you can see that they are waiting for acknowledgement. So when they are received by the other practice, an acknowledgement file will come back and you'll see those ones that have been acknowledged. If there's a single attachment in that patient's file that is too large to send and there are no other attachments to split it into, then the export will stop with the message saying the external document's too large to send via GP to GP. Those will have to be sent using your old manual message. Okay, when you receive a multi-file record, this GP to GP change has been sent out to all PMS vendors. So if you do receive a patient transfer in file, you can see here I've got Arnie Smith in twice. If I open up the first item there, comes up with a wee message saying this record has multiple files. And we are viewing the primary file. We can see that in this reference number at the top here, it ends in A01. If I was to open the second one first, or one of the other secondary files, then it says that you're not viewing a primary file. So it is asking you to ensure that you import everything to access the complete record. So the best practice is to start with A01 and import that first. So checking that you've got the match correct, you've got your import button, you'd import that and then move to the next one. If you do these in the wrong order, you will just need to go back and do the first one first and run through again. Okay. Right, so that is version 9 changes. The would recommend that you do have a look at the release notes. If you've got any questions, that Q&A button at the top, I'll just bring in Rebecca and see if she's got anything that she can run us through.
Hi everyone. So we've had quite a few questions coming in. So the first one that I know that is an important question is, does Medtech still give the option for fix later to save immunization records with errors? So Liz, that was one of our top questions that we thought we might get asked.
Okay. So if, oh, sorry, I'm just going to flash on the screen. So the fix later button, so rather than popping up lots of error messages and putting them into the inbox, you're going to get a warning for if you've got any patient register issues, and that allows you to correct them at the time. So you can't get through halfway through a record, excuse me, before being told to fix them. So after you've fixed those, then you're going to get your immunization field warnings. So for things like having no batch number, those mandatory ones, you do need to fill them out at the time. There are some things that will allow you to send now, like if you're missing that batch expiry date. So yeah, so you can still send some things via send now, but other items that will need to be filled out at the time. And by doing that, that ensures that you are sending accurate information, and you don't get a inbox clogged up full of items that colleagues have not finished up with. So yeah, big focus on data accuracy for this upgrade. Thanks, Rebecca.
Well, a few people have messaged in asking about there being the pre-release notes on Insight, and they're wondering where the full release notes will be released.
Yep, the full release notes are in the download section of the Insight portal. So yeah, if you go log into Insight portal, go to downloads, and the first thing that will show is version 9, and the release notes are under that. They look like this. We can send out a link. We'll send a
We can
link
include
to
it
the
in
video.
this afternoon's email. Yep.
Yeah, we'll send out a link for that.
Would you like it to pick a question, Liz?
Reschedule reasons prior to updated version 9, are we still required to correct these? You can't correct them now because we've taken away that field. So I would just remove those reschedule reasons out of your inbox. You can inactivate those or file them. Immunisation records, are they sent from Medtech to Air in real time by clicking send now, as in when this record is added to Medtech, or are they transferred later as a batch? So those immunisation records are sent via HealthLink, and your HealthLink will work on a regular cycle. So depending on what mode you've got for your HealthLink, it will be sent when the next cycle goes. So probably more as a batch than real time, depending on your HealthLink settings. Question, why is Shingrix and flu not processed the same way as all other multiple vaccines? So this is a historic process. It's been there since Shingrix was introduced several years ago. So we've just kept that so that everyone who's been doing it that way continues. Oh, a lot of questions. So if I don't get through your questions in time, we can work through them and send out an FAQ release, a bit of documentation if people have got a lot of questions. If next of kin details are not completed when entering immunisations, will it continue to send error messages until it times out? No, you will not get next of kin error message details anymore. How do we get non-schedule self-funded vaccines onto the IM schedule? So items that are self-funded, let me just pull up my screen here. So if you are doing a non-funded vaccine, you would do that through the All IM screen and go to New Term. And from here you would find, say if it was these boosters here, they say no claim or a cholera primary, no claim. You would select that and fill that in as per normal. That will submit to EAR, but yeah, these are the no claim codes. They generally start with a P dash in the code, so those are usually the privately funded vaccines. So a lot of your travel vaccines, that sort of thing, will be available through that single immunisation new term button. Okay. Have a look at the appendix in your release notes for all those codings. Do you have to use the add button to get payment for both? You can't do them individually or you won't get a co-admin fee. Correct, you have to do a new group if you're giving items on the same day. You need to use this group so that they are claimed together. If you do them singly, they will go through at the full amount for each item and get rejected. Has the way unfunded vaccines changed as it no longer generates an invoice against the patient? So we haven't changed on upgrade, nothing's changed for your invoicing side of things. If you have a service code attached to an unfunded vaccine, that should still go through. So for example, I'll just show you the setup under recall screening and vaccine. If you had something that was privately funded, say a overseas item, go down to my, so for example, one of these, this service code here is what you can add in to generate a invoice against the patient. So if you have a travel vaccine code or something like that that has a standard amount, you could add that in, or if you had a special code specifically for that particular vaccine, then you would add that service code in there and that would automatically generate for doing your vaccine if you've got the auto bill ticked. Okay, so question is, now you've inactivated historical codes. When new patients transfer in from GP to GP, their vaccinations do not load into scheduled IMS. So we haven't inactivated the historical codes, we just flagged them as historical so that they are hidden away to make it easier, shorten those lists so that only the standard ones come up first. If you want to use those historical codes, then you still can. If patients come in via GP to GP, they will still match up. I would recommend taking your vaccinations from the source of truth, Aotearoa Immunisation Register, and do a status query to pull up the latest vaccine data for the patient rather than relying on the GP to GP transfer. It may not be as accurate as what EAR has. So I would use that instead, because then you also have the ability to change if the mapping isn't as you'd expect. You have got that ability to change that mapping. Okay, a question. We've noticed our COVID vaccine claims do not go through. How can we get this set up? So COVID vaccines have never gone through the schedule. That was how EAR originally set it up, and they have not changed that in this in the specifications that are provided. So COVID vaccines continue as they have done previously, in that when they're received by EAR, the payment is made via that mechanism. So they, as far as I'm aware, what information we've been provided, they go through separately. Okay, how are we going for time? We've got time for a few more. Do we have to change the subsidy fee to 0 as we used to pre-version 9? Okay, so you should not have to change the subsidy fee at all. Not sure what pre-version 9 our people will need to do, whether that's maybe they were in the claims preview and people, the only reason I can think that may have been required if people were adding groups of vaccines in singly. So all I can suggest is just check that people aren't going through and adding these one by one using the new term. They need to be the new group and added as a group. By doing that, all of the items that are in that particular group, not a very good example there on a very old, we've got an adult here. Yeah, so use that group button to ensure that you get all of the items at once. So, for example, this 15-month-old, all of those 3 will go through together and have the correct amounts. Okay, I've got a few people that have got a couple of error messages. If you can send that through to our support team, they'll be able to assist with looking at those. Here's another one. When completing an immunisation group, if after entering the details given on the first vaccine, will it prompt you to complete the rest if you press OK in error? So, for example, I've got this 15-month open and I put in the details for the first line. I correct my date of my batch expiry, and if I hit OK now, it will come up and give me warning messages that I've missed out for various items here. So vaccination site, batch, diluent, etc. So you then are asked to correct those items before moving on. So yes, you will get asked to fix that up. Okay. Got someone here who's added lots of custom vaccines over the years, and what happens to them. So when you upgrade, all of those vaccines are that are in your setup, we classify them automatically. So anything that has got a mapping behind the scenes to a CVX code or NZVX code, that is flagged as an EAR vaccine. So I showed you that in the vaccine setup. So, for example, this one here is an EAR vaccine. So anything that you've added, any custom ones, will get added, but they will be set as non-standard. So they don't, behind the scenes, have a CVX code or indication code automatically assigned to them. So you would need to go in and put in that mapping, or you could, if you want to keep using it, you need the mapping. If you don't want to use that and you want to just use the standard sets that are in there, you can make yours inactive and then use the standard EAR codes. One thing that I would caution if you are going to use your own codes is that when an item comes in through EAR, the immunisation updates, that you may find that the mapping will look at your codes as well. So, so that it may look a little bit disjointed in your all immunisations list. So I would recommend that you make them inactive and use the standard ones, if at all possible. Okay. Yeah, I think that covers about all the questions that we have today. What we'll do, I'll just minimize that for a second. Now, for anyone who has been upgraded and you were on version 8 previously and have jumped to version 9, there was a version 8.3 release that we put out in May, and that release had a lot of software improvement suggestions. So I would recommend, we did a webinar on that yesterday. We have got that on published, so if you want to Google it, Evolution version 8.3, you'll find a webinar there that you can run through. That had lots of software improvement suggestions. This version 9 was a sector services release, so a mandatory release due to those EAR changes. If you have got any suggestions for things that you would like included in upcoming roadmap, then please scan the QR code that you've got on the screen there and let us know what it is that we can do to make improvements for Evolution. One last note there, if you for those practices that are on the Evolution Cloud, we are scheduling you to upgrade you as soon as we can, so you should get a notification of what date that is for you. We would recommend finalising all your outstanding immunisation claims before you're upgraded. It's not the end of the world if you don't. It's a nice demarcation between the co-admin for version 9 will be complete if you have that cut-off line. But you can still send your claims after you get to version 9. Just you'll need to put in that adjustment for the additional co-payment of the co-admin fee. Okay. I think that covers everything. Thank you so much for joining us. We appreciate the time you're taking and your interest. We thank you for your questions and your feedback, and take care. Enjoy the rest of the short week. Happy Matariki, ka kite anō.